what can physical therapy / massage do for TMJ? So let's start with a little bit of an explanation. Your TMJ is the joint that is found on the side of the jaw, temporomandibular joint, and a lot of times these are called temporomandibular disorders when you have pain or clicking or popping or locking in the jaw can be very debilitating. Sometimes it's a result of the clenching and grinding and stress that many of us carry, and it can, or dental work that you have had if your alignment is a little bit off in your mouth, you can start to develop. It's a joint, it's a hinge joint between the top and the bottom of the jaw, and it's quite unique in how it works, but because of some of those things that we just discussed, it can become out of joint, it can become painful, it can click and lock. And so what can physical therapists or with the help of massage therapists do for TMJ pain? Well, a great deal. So what I would like to start by saying is sometimes we work together in conjunction with dentists or orthodontists who are specifically specialized in working with TMJ. There's also a provider in the local area, and her name is escaping me, Tamara Higgs, and her title is called a myofunctional therapist. I will drop her information. We've done some work with her in the last year and a half as well. And she works with a dentist specifically who works with patients with TMJ disorders. And the myofunctional therapy is a therapy all of its own. And I could talk a Q&A on that specifically. But what I would say is sometimes we work in conjunction with another healthcare provider who is a dentist or a myofunctional therapist who is working on specifically the joint and pain management and realignment, and they want, by way of maybe an appliance or some injections or some kind of work that they need to do, and then they send them to physical therapy for our side of things. That is not always the case, and like we've talked about and Raven has shared in the past, you do not need to see a healthcare provider or be seeing a specialized dentist or myofunctional therapist to come to us. We can be your first stop, and if we think you need help, we'll send you for the referral out. But what I would tell you is if you are experiencing TMJ pain symptoms, a good place to start is with physical therapists, because a therapist who is trained in evaluating and treating the jaw is going to do a thorough evaluation just like we would for any other part of your body. We look at the mechanics of the jaw, which involve really opening and closing your mouth, moving your jaw side to side, what you're able to do with your tongue. And we're looking and listening to see how the mechanics of the joint are moving. Are they symmetrical? Is there deviation side to side? The other thing that we really closely look at and work on when you have an issue with your jaw is your neck, because your mechanics, the alignment of this joint is directly related to what your neck is doing. So if I turn to the side, you can see if I have very good upright posture, my head is sitting on top of my shoulders and my jaw is resting kind of in this neutral position. If I adopt a forward head, rounded shoulder posture, and I get this forward jutting of my head and my jaw, that actually changes the mechanics of the jaw as well. And so just like any patient, really, we're going to work on posture. We're going to work on range of motion, specifically of the upper part of the cervical spine, because that is very closely related to the jaw, and we're going to make sure those joints are moving well. And then there are exercises that can be issued specifically to strengthen and stretch and realign the mechanics and muscles around the jaw. And we along with a massage therapist, can do quite a bit with myofascial release and manual therapy. So manual therapy to make sure the joints here and here are moving like they should, and myofascial release or massage to the muscles. They're called muscles of mastication. So you have the masseter muscles here, which are your clenchers. There are lateral pterygoid muscles here, your scalenes on the side of the neck, your temporalis muscle on the side here. So all of these, kind of muscles in this region can be worked on and released, that can provide some symptomatic relief of any of the symptoms you're having. But also when you work on muscles that are short and tight, then you have improved blood flow and functionality, and we can alleviate some of those symptoms. There are techniques for those that are willing to go there that involve releasing the masseter on the inside of the mouth. And so I can do this technique. Lindsay is also trained in the technique, but that generally involves using gloves and putting your finger inside the mouth and kind of clenching that masseter between your fingers and working to release that muscle here. None of those things are very comfortable at all, but they are quite effective. The other thing that I would say, we've talked about MYK in the past here in this group, which is a treatment tool in our tool belt that we use at Fit for Life. And MYK, especially for the upper cervical nerves, has been quite helpful in relieving some of the postural imbalances, which is what MYK does. It balances your posture, and it also normalizes any muscle imbalance that you have between left and right. So those are some of the things that we can do with regards to physical therapy and massage therapy. If you are experiencing any painful opening, clicking, grinding, popping, locking, if you think you're a clencher or a grinder, then it may benefit you to come on in for an assessment for that jaw, and let us see if we can give you some relief of those symptoms. Let me know if you found this valuable. Thank you guys for those of you that take the time to watch this. If you do watch this on a replay, you can comment replay below. And as always, thank you guys for trusting us with your care. I hope everybody has a wonderful weekend, and we look forward to talking more with you soon. Have a great weekend.